Hello and Namaste. I'm Dr. Sudha Tandon, gynec endoscopic surgeon and IVF consultant, and I practice in Mumbai and Navi Mumbai. Today, on the occasion of the World Contraception Day, which is on September 26th, we will be speaking about contraception in a very short video. So what is contraception? I'm sure you're all very familiar with the word contraception, but let us just learn a little more about it. So when a couple wants to prevent a pregnancy or want to space a pregnancy, it is better that they use contraception than having an unwanted pregnancy, because it gives rise to too much of pressure on the couple to either abort it or to go ahead with the pregnancy and the childbirth and the delivery and taking care of the child. So let us see what are the prerequisites for a good contraception. It should be freely available. It should be able to be practiced by people from all cultures. It should not have side effects. It should not be dependent on when the couple is having coitus. And it should be a very easy thing for them to use and not be trained by anyone. So these are the prerequisites for a good contraception. Now, when we look at the contraception which is available, we have a basket of what all is available, and this can be followed either by the male or the female, that means either by the husband. So today we have a basket where the couple can choose as to what sort of contraception the couple could use when they do not want a pregnancy. So let us look into the ones which can be used by the women, and let's then look at what can be used by the men. Ideally, it should be the responsibility of taking care of the baby is on both the couples, is on both the partners, but realistically speaking, it falls more on the mother. So it becomes a responsibility of the mother or of the wife to be using the contraception and planning the pregnancy according to when she wants it. So this is not the ideal situation. So in the women, for the female, what are the options which are available as contraception? These can be divided into the temporary methods or the spacing methods or the permanent methods. Now in the temporary methods, what are the options available? One is the rhythm method, where she does not have intercourse during the time when she's fertile. So which are the fertile days? Now as you know, the egg in a woman who has regular periods gets released from the ovary either from on day 12, day 13 or day 14 or maybe even day 15. Now so if she avoids intercourse during this time, then it is, or maybe few days before and few days after that, the likelihood of her getting pregnant is less. So what she does is a very simple calculation of 30 days, and she has intercourse from the first day of her periods for the next 10 days, avoids it for the middle 10 days, and then she could have it from the 20th day to the 30th day she could have intercourse. But what are the drawbacks of this rhythm method? Though it's a natural method, she does not use anything. It can be only used by women who have regular periods. Women with irregular periods cannot use it, and there is a very high failure rate. Next is the barrier method, where the woman either uses female condom, a diaphragm, or a cervical cap. These are not very commonly used, not very popular, because they are little bit not very easy to use. Next we have is the chemical method of contraception, where she uses spermicidal agents either in the form of tablets, foams, jellies, where she uses it in the vagina. The sperms will get killed. This also can cause irritation and allergy, and this is also not popular. So what are the popular methods is either the use of intrauterine device, which is the IUD, or hormonal contraception, which are known as the oral contraception. IUD is introduced by a gynecologist in their clinics. It's an OPD procedure. It is to be done immediately after periods, because then we are sure that there is no pregnancy. It can also be done after delivery, and there are various different methods of IUDs which are available, and the action lasts for about 3 to sometimes even 7 years. Some IUDs are medicated, which is the LNG intrauterine device, and these can be used for 7 years. They are also very useful for women who have excessive bleeding. What are the drawbacks of an IUD? The drawbacks of an IUD would be that There could be excessive bleeding, there can be pain during periods, and also the IUD can get expelled and the woman would not know. She would think that she's getting protected, but it would have got expelled. Another important problem with IUD is that it does not protect from tubal pregnancy or an ectopic pregnancy. So a tubal pregnancy can occur even when there is an IUD inside the uterus. How does the IUD work? It is a foreign body and prevents the implantation of the embryo, and that is how it works. Next important contraception which is used by millions of women is the oral contraceptive pills, which are very, very freely available. Now these come in a packs of either 21 or 24, or there are even some packs where the woman uses it for 3 cycles at a stretch. So these are to be used. Now suppose there is a packet of 21 tablets. She uses from day 1 of the period for 21 days, then has a gap of 7 days where she will not be using the tablets and she would get her periods. Important point in this is that she should not miss her tablet. She should take the tablet regularly on the same time every day for the 21 days. The problem with these tablets could be that the first cycle she may not be protected, but the protection is very good with an oral contraceptive pill. And the failure rate is extremely less with an oral contraceptive pill. What are the other benefits of an oral contraceptive pill? The pain during periods become less. Her premenstrual symptoms also become less. There is less of anemia because the amount of bleeding which occurs is very less. She would almost bleed for about 10 to 20% of what she normally bleeds, and hence her hemoglobin rises and it takes care of her anemia. It also is a very good method of preventing of ovarian cysts and maybe taking care of other problems like ovarian endometriosis. There are other ways of hormonal contraception where you could have only progesterone tablet. Remember, the oral contraceptive pills has both estrogen and progesterone in various doses. The dose of estrogen is extremely less and hence the side effects are very less. So how does oral contraceptive work? Basically, because they are hormonal tablets which contain a very small dose of estrogen and progesterone, they inhibit ovulation. So basically the egg does not get released in the woman's body. Who are the women who cannot take an oral contraceptive pill? Well, oral contraceptive pills can be safely given to women less than 35 years, who are normal weight, who do not have any liver problems, who do not have hypertension, who do not have any deep vein thrombosis problem in the past, and women who are not very, very obese. So these are the contraindications: women who are about 35, women who smoke, women who have a deep vein thrombosis, women who have hypertension or a liver disease. These are the women that an oral contraceptive pill is contraindicated. Which are the other forms of hormonal contraception? Well, you're very familiar and you would probably know as to what is the postcoital pill. Now, this postcoital pill is very popular among the young women and sometimes even with the married women. Unfortunately, it should not be used by women who have regular intercourse, because if there is regular intercourse, then having a postcoital pill only once leads to a very high failure rate. And it's important to remember that the woman takes the tablets within 72 hours of an unprotected coitus. Also, there is a very high failure rate. So, if you have taken a postcoital pill for an unplanned contraception and you do not get your periods, please consult your gynecologist, get a pregnancy test and see whether it has worked for you or it has not worked for you. There are other ways of injectable hormonal contraception wherein a high dose is given in a 2-monthly or a 3-monthly injection. These are also very popular in some countries, and this could be used in quite a few women who want contraception. So what are the permanent method of contraception in a woman? The permanent method of contraception in a woman is tubal ligation, where the tubes, the fallopian tubes, both the fallopian tubes by the side of the uterus, the doctor will ligate it or a small band is put on the fallopian tubes, or the tubes are cut completely. Now this is done by a small surgery, either by a very small incision on the abdomen or through laparoscopy. Now remember, this is a permanent method, and unless you are very sure that your family is complete, you should not be going in for it. Generally, we do it when the woman also undergoes a third cesarean, then we do a tubal ligation along with a cesarean. So after we have discussed the contraception options for the women, let's just quickly look into what are the contraception options which the males can follow. Now again, in males also we have something which is reversible and something which is permanent. So the reversible method, which is the most common method, is the use of condom, which is also very popularly called as Nirodh in our country. Now he has to use a new condom at the time of coitus, and it should not be reused. The other advantage of using a condom is that it also prevents a sexually transmitted disease. One must remember that there is no need for the male to test whether the condom is proper or no. As in the female, there is also permanent sterilization, which is the vasectomy in the males. Vasectomy is a very simple operation where there are no stitches, there is no anesthesia which is required, and the males can go home on the same day. Now remember, it's a permanent method of sterilization, and the reversal of vasectomy is also not very easy and not very successful. So if the male is planning that he may want children later on, he could freeze his sperms before doing a vasectomy. There are a lot of newer recent advances in the field of male contraception. There could be some tablets, some vaccines, but they are still under trial and they're not freely available in the market. Hopefully, you've liked this video and you found the content useful. Kindly subscribe to our channel and follow us on Facebook and Instagram. Thank you.